Thank you very much, Congressman Price. I'm going to get things started and ask a very quick question. Take your federal hat off. What should we be doing at the state level during this interim time when we're waiting on things to develop?
First of all, I want to say that you are incredibly fortunate to have Dr. Price representing you, and we are in Washington incredibly fortunate to have his leadership. And I really do believe that the leadership of Congress understands how important it is to not only have someone with Dr. Price's values and belief in this country and liberty, but also someone who understands the healthcare system. They understand how important it is to have leadership on this issue. I really do believe that Congress was poised to do health reform in 2007. The White House decided to do Social Security instead, and I think when you lost the majorities that really took away that opportunity. And when people say, oh, well, you had your chance, you should have done it before, they were ready to do it. And with Dr. Price's leadership, they will. And he understands this from a policy perspective and most importantly from a real world perspective. So what should Georgia do? It's impossible to know whether or not this law is going to go into effect. So what Georgia needs to do is figure out what works for Georgia. And one thing that might work is setting up a minimal exchange. The Utah Health Exchange model is a good one that provides a vehicle for defined contributions, sort of like the portability of 401ks and IRAs, where an employer can say, I'm going to pay $2,000 a year for your health insurance. And I want you to get on a pre-tax basis. You can put it into this exchange as a way of aggregating premiums from individuals, from employers, maybe any subsidy money that's available, charity money, and then providing a portal so that the person gets to pick their own insurance, more than they might be able to do if they work for an employer who can only offer one plan. So they'd have more choices. That would engender more competition. And importantly, that policy then could be portable. So the person didn't have to lose it. If they switched jobs, they own the policy. And you begin to move toward the kind of system of individual ownership of health insurance that I really believe is part of the 21st century. And I would dare Washington, if you get a system like that set up, I dare Washington to say, we don't like your exchange. We want you to set up ours according to our rules. So I think it first inoculates you against the exchanges, because under this law, if you don't set up an exchange, Secretary Sebelius is going to come and do it for you. So it inoculates you, but it also allows you to create a solution that may very well work for portability for your state. There are a number of other things. The Freedom of Choice Act. Have you passed in the legislature the Freedom of Choice Act yet in Virginia in Georgia? You might want to think about that, just as another way of making a statement that individuals should not be forced by the federal government. The citizens of Georgia can't be told by Washington that they must buy a $20,000 health insurance policy or face a fine on their taxes. And don't get sucked in to a lot of these grants, the grants to regulate health insurance premiums. Florida just gave back $1 million because they said, too many strings attached here. If we take this grant, then Washington's going to be able to tell us what to do. So look at that and decide whether or not that money is worth having Washington come in and tell you what to do. And I think most importantly, the legislature really needs to hold hearings and talk about the impact already on citizens with this health insurance. This costs are already going up. Many companies are thinking they're just going to have to get out of the business of providing health insurance altogether. What's happening to physicians? How many of them are deciding to retire from practice? People need to know that not only are there impacts coming, it's already happening now. People who are losing their jobs because stores are deciding to put in electronic scanners because they're afraid of the benefit mandates that are coming if they have employees. CVS, for example, is eliminating jobs with electronic scanners because it's afraid of the employer mandate for health insurance. Look at what other states are doing, like the Healthy Indiana, which is a program that Governor Daniels has introduced that provides an HSA model plan for the uninsured. Uses some Medicaid money, some state tax money, but it's a hugely popular plan and certainly something worth emulating. Look at the alliances of states. I think the southern states could harmonize your health insurance markets and your regulations and mandates. So that we were talking about this earlier, Kelly, to create a regional alliance so that you can have more competition by cross-state purchasing. So there are a lot of things you can do here that are the right thing for Georgia and the right thing for your citizens and the right thing for businesses. And then whatever happens in Washington, you're doing the right thing. So get started with that now.
Let me just underscore a couple of things that Grace Marie said, because a very, very cogent and wise response. I'll give you a couple of takeaways from that. One, do what's right for Georgia. I wouldn't tell you to ignore the rules coming out of Washington, but I would tell you that I wouldn't be confined by them. Whatever you call it, whether it's an exchange or an opportunity to get folks covered here in our state, whatever we do here, if it works, I believe there are great opportunities that are going to be out there to be grandfathered or exempted or whatever. So I would urge the state to go forward. Secondly, I would make certain that you don't buy into just the constraints of the bill as it's been put in place. I have had a couple conversations with folks who are good, strong, libertarian/conservatives who are working in states that are now charged with implementing this exchange, and the words that I hear coming out of their mouth just scare me to death, because they say, well, we've got to make certain that we do it just this way, the way that the federal government is prescribing it, which is an affront to the ability of individuals to make those independent decisions. Don't be sucked in to that. And then always be wary of grant money. Always be wary of grant money. Because the small print rarely, if ever, allows you to utilize it in the way that you want it to be utilized. It most often requires you to use it in the way that somebody else decides, and that may or may not be in the best interest of you or your constituents.
Questions?
I've got one. My reading of the Judge Vinson ruling is that it's in effect, it's really an injunction, isn't it? And doesn't it require the government to stop doing this until another court overrules that?
Well, I'm not a lawyer either, but I talked to General Beast last night. And I listened to what Cuccinelli says. And Mark Levin, who is a lawyer, he was talking about this last night on his program, and he said that the federal government can't ignore any federal judge that says that a law is unconstitutional. And so they have to take very seriously what Judge Vinson has said. The government has not yet appealed that ruling. I don't know what their time limit is, but you know they're going to do it. And until they appeal it, then they can't, the plaintiffs can't file alternative proposals. But one of the things that the federal government's likely to do is to say that they want to stay on Judge Vinson's ruling until the appeals court rules. So they're basically, in all the double, triple, quadruple negatives of legal terminology, they want to put a stay on what is a de facto injunction. Because yes, he said, and it's really interesting it's really a beautifully, elegantly written opinion. And he said the government told us 14 times that the individual mandate was central and structural to their plan. And he says, I have no choice but to say the whole thing is therefore unconstitutional. You told me it can't work without this. And if I'm saying that the individual mandate is unconstitutional, then you're telling me you can't implement the whole thing. And Jonathan Turley, a huge supporter of this legislation, a leftist and a lawyer for George Washington University, said yesterday in the USA Today, he said, basically, the government was playing a game of chicken, and they lost. They have no one to blame but themselves. If they said, you got to have the individual mandate, and the judge says it's unconstitutional, you lose. That's why I like the Ronald Reagan quote.
Yeah, but we have, what we're calling for is an expedited review with, from the Supreme Court, because this is going to get there, and the sooner it gets there, the sooner states and everybody else can move on. To that point, I think we're still 5-4 on the Supreme Court with this. It could be 6-3, but I think we're 5-4, and on the good guys' side. So, but that, you know, the Supreme Court is temporal. I mean, it can change in a heartbeat, literally, and so the time to get a ruling is ASAP.
I have a question for you, Tom. I know you've got your new bill that's going to be coming out. I think Dick Armey said that demagoguery oftentimes beats data, especially in the political realm. You know you're going to get demagogued to death when this bill comes out. I think the CBO said you had about 3 million people based on that bill to the health insurance rolls. How do you plan on demagoguing those opposition opponents that are going to come out and say, oh, see, you're really not expanding health insurance coverage to other people? You have to obviously have a plan to kind of change that.
Brian's question is how do you fight the demagoguery of the alternative proposal, citing the CBO saying that it only covers 3 million individuals. The CBO statement on that was on the official Republican alternative, which I support, but it's not a comprehensive alternative, which is what 3400 is, I believe. Now, 3400 is a bill that we had. I think we were up to 60-odd co-sponsors, looking for something. Jess had nodding his head. That came out of the work in the Republican Study Committee that we believe covers everybody, because it provides tax deductions, credits, advanceable credits, refundable advanceable credits, so that everybody has the financial wherewithal to purchase coverage that they want for themselves and for their families. But it's coverage that they select, not that the government selects for them. So I think you fight demagoguery with facts, but you do it in an optimistic tone, and you do it upbeat and positively, and you know, if they want to say, look, the only way to fix this is to put the government in charge, and we want to say the only way to fix this is to put patients in charge, I'm all right with that. You know, that's a battle that I don't mind.
Bill?
Just one other additional thought. I think there's a different climate now. I think the American people really understand what it means. They thought for a long time, oh, the government's just going to give me free health insurance and everything's going to be wonderful and there won't be any more paperwork. They now understand what this means. And so I think there's a different understanding of what the policy will be. And they see that the promises are not being met. The president said, I'm going to lower your health insurance premiums, the average family premium, by $2,500. CBO says the average family premium in the individual market is going to go up by $2,100 a year. That's missing the mark by $4,600. And so I think they're going to be open to more patient-friendly, market-friendly, competition-based plans like Dr. Price's.
There's a number of states that have passed legislation to nullify the federal health care bill. Was that a good way to go? And then how can we do that in Georgia?
A number of states have passed, the question, a number of states have passed bills to nullify the federal legislation. Is that a good idea? And how can we do that in Georgia? Yeah, I think anything that one can do to fight this monstrosity is exactly what one ought to be doing. And that means everybody has a role. And so for the states that were able to muster the political will to battle it by saying, no, you can't, then that's great. In Georgia, as you know, we've joined the suit, the Florida suit, that I think is appropriate. There are other things that can be done, but this battle never done, by the way, never. Even when we win this one, this battle's never done, which is why you got an orthopedic surgeon sitting in front of you trying to work in Congress, because the battle of ideas is a lifetime battle, and it continues forever and ever and ever. And so the price of freedom, you remember, is eternal vigilance. So we got to be vigilant and keep fighting forever.
We did pass a statutory Freedom of Choice Act. We couldn't get the constitutional requirement. Maybe things have changed since the last election, so that may be a possibility. We've got time for one more.
I'd like to hear your comments on how the administration is justifying all these waivers they're issuing against tobacco. What is the logic against this wonderful piece of legislation that they're issuing waivers left and right for all these companies that apply for them.
Question is, how does the administration justify the waivers that they've already provided? Now over 700 waivers to businesses and unions and others. And the answer to the question is they can't. I mean, they try to say that you know, the law is complex and it's difficult to institute and it takes time but the fact of the matter is that it doesn't work. And so when you've got real people trying to make real payments and take care of real employees and provide real services and real products in the market, this doesn't work. And so that's why it'll come tumbling down, whether it's through the courts or whether it's through the implementation itself. But the honest answer to your question is that they can't. And when you see them try to nuance it and answer those questions, as Grace Marie said, the pretzel is the appropriate definition.
Have y'all seen this chart? This is the most amazing thing. This was done by the Joint Economic. It looks like, oh, it's just a sort of a character. It's not. They worked on this for 6 months to try to map 1/3 of this law. They said if they tried to do it be bigger, they couldn't. The computer started to crash. These are some of the 159 agencies or so. Congressional Research Service can't even be sure how many there are in this legislation. I've got about 10 copies here. I'll give the first 10 copies to people who give me their business card. I do a weekly electronic newsletter to keep people up to date on what's going on this on these issues. So give me your business card. I'll give you a copy of the chart and show it to all your friends, because it really shows you that it can't work. It cannot work. And people get it. One of the reasons I think that the waivers are so, just people roll their eyes is because it's just more of the Cornhusker kickback and the Yukon and the Gatorade and the Louisiana Purchase and all the stuff they did to get this thing passed. And now they're picking winners and losers and giving these waivers. And by the way, a disproportionate number of them are labor unions. All their friends and all their buddies. Oh, we want to pass this for everybody else, but we want to protect our friends. Michael Barone says this is gangster government. You cannot have this, and it's another reason it's going to fail.
Let's thank our two speakers for this wonderful